Heart disease accounts for 1 of every 6 deaths in this country.
Joining us to talk more about the new treatment for blocked vessels is the Director of Clinical Research, Greg Murphy, with Tyler Cardiovascular Consultants. Welcome.
Nice to have you here.
Thanks for having me.
First of all, when you first walked in, Greg, I just said, how do you pronounce the darn thing? Tell us exactly what this is.
Well, what it is most people are familiar with the term stent.
Right.
That's a metallic frame, if you will. This is now termed a scaffold because it's not permanent. It's made up of a polylactic acid polymer that dissolves over time. So on one hand, you have the metallic stents that we're all familiar with that are permanent. This particular scaffold is made to resorb. It turns into lactic acid over time and resorbs into the body.
And this is an incredible breakthrough, and you guys were the first to bring it to Texas.
Yes, we're the first implanting site in Texas. There are, I think, 2 other centers in the state, one in Austin and one in Houston.
Yeah. Now, how does this affect the quality of life for the patient to have this dissolving stent, so to say?
Nobody wants a permanent metallic object
Like
a foreign object.
If they can avoid it. So the main thing, there's 2 main points that we want to make here. Number one is we want the scaffold to fix the artery, to remodel the artery and allow better flow. And then we want it to go away. And by going away, it reduces the need for long-term blood thinners because these objects are foreign to the body. So the body, it doesn't reject it like with antibodies, but it does make a turbulence in the bloodstream that blood clots tend to want to form. So people that have these stents end up on a long-term antiplatelet blood thinning type of medication. Those are not without risk and not without cost.
Yeah.
This is, as you mentioned, a clinical trial. What if someone's home seeing this going, I want one of those? Well, what do you do?
Well, we hope that they don't want one.
Right.
Number one. This is a clinical trial. It's randomized. So the comparator stent is one we use every day, a drug-coated stent made by the same company, Abbott Vascular. You have to qualify. We're looking for patients that are our patients that are stable. They have coronary artery disease and they're stable. We don't want to implant this, nor does the company want us to implant this in somebody that's in an acute phases of a heart attack or what have you.
Yeah.
So they need to be stable.
Now, Greg, this is something that you were saying 20 years ago was something just unimaginable, but now it's come to fruition.
We talked about it 20 years ago. We used to say, what if? It's kind of like when we had cell phones this big. And now they're this big.
The bag phones,
Exactly. That's sort of the way we have developed with this.
Wow.
Prevention obviously is key here. Anyone who has, obviously you want to get checked out by your doctor if you're dealing with this, get checkups daily, have if you're, signs of a heart attack and know those signs, and just take better care of yourself before you get to this point.
Exactly. You don't want this, but if you do need it, we're in the developmental process of this, and it should be available hopefully if things turn out in the next 3 years or so, 3 or 4 years.
Keep us up to speed again on this. Greg Murphy, Tyler Cardiovascular Consultants, thanks for coming in.
Thank you very much.
Amazing technology.
Thank you. Up next.